What is iron deficiency anemia, and what are some symptoms to watch out for, especially as women? Anemia is a condition where your body does not produce enough red blood cells, or those red blood cells don't work well enough. Red blood cells are what carry oxygen to the various parts of the body, and they do this with the help of a substance known as hemoglobin. Iron is essential in the production of hemoglobin in the body. Iron deficiency anemia, as the name suggests, is when your body is deficient in iron. In the absence of enough amounts of iron, the body is not able to produce sufficient amounts of hemoglobin, and this results in symptoms such as tiredness or shortness of breath. Iron deficiency anemia is much more common in women than in men, and globally, about 30% of women in the reproductive age group will have iron deficiency anemia. There are two groups of women in particular that are especially vulnerable to developing this condition. The first are menstruating women that have heavy bleeding during their periods, which results in a loss of blood. The second is women that are pregnant. During pregnancy, your body's need for iron increases in order to support the growth and development of your unborn baby and to also support your own increased blood volume. There can also be other causes such as not having enough amounts of iron in your diet or poor iron absorption in the intestines. Some common symptoms that you should keep an eye out for are extreme tiredness or fatigue, weakness, pale or sallow skin, dizziness and headaches, a fast heartbeat, having shortness of breath or pain in the chest, especially with physical activity, cold hands and feet, brittle nails, a soreness of the tongue, and an unusual craving for non-nutritive substances such as ice or clay or dirt. So what are some treatment options for iron deficiency anemia? The first is to increase your dietary iron. This can be done by eating iron-rich foods such as meat, poultry, fish, dark leafy greens, legumes, and pulses that are rich in iron. Second is eating foods that are rich in vitamin C. Vitamin C improves the absorption of iron in your body. This can be foods such as broccoli, oranges, leafy greens, tomatoes, strawberries, etc. And lastly, taking iron supplements as directed by your doctor. Iron supplements should ideally be taken on an empty stomach, but if you're not able to tolerate this for any reason, you can take them with meals. Iron supplements should not be combined with antacids, and you can take them with foods containing vitamin C to improve their absorption. So if you are suffering from any of these symptoms, especially if you're a woman in the reproductive age group, speak to your doctor. Your doctor can order a number of simple tests to diagnose iron deficiency anemia, and after evaluating the results of your test, they can guide you about the right treatment options for you.